And I think that the weather is good here too. It's nice seeing you over there. And I hope everything's going well.
By the grace of God, everything is going great, Prof. Thank you so much. Thank you so much. All right. So with the men's words, you welcome, ladies and gentlemen, and distinguished guests and speakers all across the continent. I greetings to you from the COVID-19 Diary team. And we're looking at this very, very important virtual symposium on the theme, Effectiveness of African Health Systems in Managing Pandemics. And I believe that you have followed us since the beginning, when we began with the first edition, all the way to this very 9th edition. And you've appreciated how we've tackled all aspects of the pandemic, from the myths surrounding the pandemic, understanding the origin, vaccines, development, the variants, and a whole lot more, to now that we're looking at how we as a continent can strengthen our health systems to manage pandemics. So we'll begin with the very first thing. This is brought to you by the COVID-19 Diary under the able support of the Association of African Universities and the National Research Foundation in South Africa. Let's do the first thing and welcome in the anthem for the AAU. May you all be silent as we have the anthem play. Thank you. I call on the technical team in Ghana. Can you please let us hear the anthem for the AAU? Sorry.
Yeah, when I should be down.
Any feed from Ghana, technical team in Ghana, with the anthem for the AAU, please?
Can you contact them by phone?
Okay, I'll do that. All right, okay.
Yes,
so
thank you.
Great. As we wait for the anthem to play, we'll have to move on with the schedule. So on the program, we have a warm address that will be done, an introduction also by Ms. Nonomo Dlamini. She is the Director for ICT and Knowledge Management at the Association of African Universities. She will do us the honors by welcoming the program on behalf and introducing the Secretary General for the AAU.
Thank you very much. May I have permission to share the screen? Greetings to everyone from Accra, Ghana. We are connecting from the Association of African Universities. We are very happy to have all of you connected, and we hope that you will enjoy our stay with us as we present the COVID-19 diary once again to you today. And it gives me a great pleasure to introduce my boss, Professor Olushola Oyewole, who is going to be giving welcoming remarks and a speech concerning why we are here. So I'm sure you are all familiar with Professor Olushola Oyewole. He is the Secretary General of the Association of African Universities. He holds a Bachelor of Science degree from Obafemi Awolowo University in Nigeria, a Master of Science from the University of Ibadan, and a PhD in Food Science and Technology, also from the University of Ibadan. He is a full professor of food microbiology and biotechnology. He has supervised many students in this area, and even though he is now the Secretary General of the AAU, he continues to supervise some students. He's published in several scholarly and peer-reviewed journals. He has written book chapters, books, conference, and technical papers. It might also interest you to know that he's the former Vice Chancellor of the Federal University of Agriculture, Abeokuta, in Nigeria. He's also a former senior expert on higher education at the African Union Commission in Ethiopia, Addis Ababa. Professor Oyewole's major interests in higher education include internationalization, quality assurance, science, technology, and innovation, globalization, higher education policy, leadership, and management. As you all are aware, he's very dynamic, very passionate about what we can do to improve higher education in Africa. So the COVID-19 diary is just an example of one of the initiatives that Professor Oyewole is leading at the Association of African Universities to ensure that as an association we are being responsive to what is happening around us. So Professor Oyewole, you are most welcome, and may I hand over to you so that you give your speech. Thank you very much.
Thank you very much, Madam Nodumo, and I want to appreciate you. Indeed, appreciate every staff of AAU for the great work we are doing in the Association for Africa. Let me also have a welcome to this particular forum, science journalists, health journalists, communicators and researchers, the higher education community, members of the Inky fraternity and the mass media, distinguished ladies and gentlemen. Permit me to stand on the existing protocols to welcome every one of us to the symposium of today. The Association of African Universities is Africa's apex higher education body with a membership of over 400 higher education institutions spread across the geographical and linguistic device of Africa. Our vision is to be the leading advocate for higher education in Africa, with the capacity to provide support for our member institutions in meeting national, continental, and global needs. This is exactly what we are doing with the AAU response to COVID-19 pandemic. Our intervention since the declaration of the pandemic in March 2020 has been very swift. While COVID-19 brought in its wake a chain of negative impact, we saw in it an opportunity that African universities can explore to introduce technology-based platforms for teaching, learning, and research. We immediately conducted a brief assessment of the preparedness of African universities to adjust to the COVID-19 safety measures introduced by Africa. We began conducting online teaching and learning webinars to discuss the effective integration of online education with the meeting one held on the 38th of March 2020. Ladies and gentlemen, I've been having some thoughts about the pandemic within the past few days. And the first thought is this: as African, what have we really learned from COVID-19 pandemic? Have we really learned our lessons? And I wonder, I don't pray for it, but if another pandemic comes up now, are we prepared as Africans to stand up to that pandemic? These are questions that I believe that all of us as Africans need to start to think about. Have we been able to put in the necessary infrastructure, the necessary human capacity, and research capabilities for us to be able to attend to any pandemic that may arise in the future? Ladies and gentlemen, we stand for universities in Africa, and various initiatives are taken by African universities to actively participate in high-end research towards finding a cure or solution for COVID-19. I know about the African Center of Excellence for the Genomics of Infectious Diseases at the Redeemers University, Ede in Nigeria, that of the University of Ghana Health Services, and the Noguchi Memorial Institute for Medical Research. They all formed a joint emergency response team, and many other universities in Africa rose up to the challenges. These show the dedication and relevance of African higher education in responding to and meeting the societal needs and challenges. When the National Research Foundation of South Africa announced its support for the COVID-19 Africa Rapid Grant Fund to champion the development of media content on public health data on emerging infectious diseases, the AAU put in a proposal and won a bid to support science and health journalists and communicators in producing and disseminating actual information for informed actions and challenge misinformation that have been put on to confuse the public. Ladies and gentlemen, to successfully implement activities proposed to the NRF, the AAU has leveraged the existence of its television unit, the AAU TV, to develop the COVID-19 diary series, to provoke discussions and build the capacity of science journalists, academics, and researchers on proper reportage on the pandemic and infectious diseases using science and data. Since inception in August 2021, we've had 8 episodes covering various subjects: understanding the genomics of SARS-CoV-2, understanding the myths versus science of COVID-19, vaccine development, the variants and the herd immunity, origins of immunization in African culture and traditional medicine, fighting infodemics through science journalism, factors contributing to infodemics on SARS-CoV-2, public health infectious disease and pandemic. And in the last episode, we had a 2-day capacity building workshop on infodemics management in Africa. Today, we are wrapping up this season of the COVID-19 diary program with a symposium under the theme, The Effectiveness of African Health System in Managing the Pandemics. Ladies and gentlemen, I want to appreciate every one of us connected to the program today. And I want you to know that as leaders, journalists, researchers, we have responsibilities. Beside these television episodes, which are available to you on YouTube and also broadcast on AAU TV via satellite transmission, the COVID-19 Diary has produced both a drama series and articles on some of the topics. And I want all of you to be proud of the success story of this particular program in AAU. Today's episode, which is addressing the preparedness of our African healthcare system in managing pandemics, is of extreme importance to every stakeholders in the health sector and therefore needs to be disseminated widely. This symposium is assessing the responsiveness of the existing health system in Africa in terms of adequacy of personnel, infrastructure, equipment, and access to safe and efficacious drugs in disease prevention, control, and mitigation. While it remains essential in many sub-Saharan African countries to continue advocacy for increased investment in health, there is substantial untapped potentials residing in the human capital and the indigenous knowledge of the end users, thus improving the delivery capacity of national health services in Africa. It goes beyond the declaration and increased financing. It also requires the input of communities. I will, however, not jump the gun, ladies and gentlemen, while the experts are here to talk. But I'm positive that the recommendation from the symposium today will be developed into a position paper and policy briefs that can guide African states to review their existing health system and policies and improve upon where we have inadequacies today. Let all of us, please, wherever you are, support the COVID-19 Diary as it develops more health programs for Africa and Africans. Science journalists that are connected here and researchers, I want all of us to know that we have responsibility to this continent. I'm very hopeful that Africa will not remain the same. We'll be ready to meet up the challenges of any pandemic that may face us in the future. I want to thank you for being part of this, and I look forward to a very important contribution that will be made by all our participants. Once again, Madam Nodumo and all of us, Ajiman, that are anchoring this program, I appreciate you, and I thank you for your very important professional contributions, not just to the COVID-19 Diary, but to all the programs of AAU. I'm proud of all of you. Thank you very much.
Thank you so much, Professor Olusholo Oyewole, for your succinct submission to open up the program. We're so glad that you're with us. From day one, you've been with us, and your support is highly appreciated. So back in Ghana, my team, Isabella and Imelda, this is where you and I together would have to do a recap for our participants to appreciate where the journey began, where the train started, and where we're heading. So you bear with me that we began with episode 1, where we understood SARS-CoV-2, episode 2, where we understood the myth versus the science of the COVID-19 pandemic, and also 3, where we talked about vaccine development, variants and herd immunity. And that is where I want to come to you, Bella and Imelda. What has been your feeling thus far? How do you feel being able to put all these episodes out there and a whole lot more, educating the constantly about this pandemic that came quite mysterious, but yet we held it down? How has it been for you all this while being on this train, the COVID-19 Diary train?
Yeah,
Perfect.
very clear.
Sure. Omicron, yeah, beta, yeah, sure. Great, Imelda, let's hear from you. Looking great. You're looking wonderful. I'm doing good by God's grace here in Lagos. Thank you. Thank you. Yes. Yes. Watch us live. What we're doing today is live on TV, so just catch us in there and realize that it's been a great time thus far with the COVID-19 diary. And I wouldn't want to miss it. I'll say, if you're joining us, you're welcome. I'm police who are joining me, LASU, A Center, welcome all of you to this platform, joining us to have a great time, learn and understand all about the pandemic and what we're doing on the continent. So the next item on the list is the COVID-19 Diaries radio drama. So we began to do a radio drama. We did a couple of them for you during the previous edition. So the radio drama will come up shortly, starring some of the members in this program. So afterwards, after you appreciate the voices and you understand the storyline, I will tell you who played what character. All right. So thank you very much for joining us. Just enjoy yourself and just don't change it down. Just stay with us. Okay. It will be a great time. Thank you. Yes, I can see the screen being shared. I'm just hoping the technical team is looking forward to quickly have it played. I can see COVID-19 number 3 on the screen. Team lead back in Ghana, can you facilitate this for us so we can hear the recording, please? We have any challenges, please, team? If we are, just kindly communicate so we can proceed. If any, we can still have a recording play.
Can we have this drama at the end of the whole program, where we just go ahead to the first facilitator?
Very well, Prof. Very well, Prof. We will note that down. So, team lead back in Ghana, kindly let's have this recording play at the latter part of the program as we move on quickly to the very first we have today. So today we have a number of speakers. I'm going to do a quick one on their area of expertise and their background, so we will be able to appreciate what they have for us. So first of all, we'll be having Dr. Ahmed Ogwell Uma. He's the Deputy Director for the African Centers for Disease Control, ACDC, and he will be talking about the emerging infectious diseases and the preparedness of African healthcare systems. Later on, we'll have Dr. Kojo Asamoah-Kwesi. He is a Senior Research Fellow, Immunology Department, NMIMR. And he'll be talking about the contribution of African higher education to the effectiveness of our health systems in managing pandemics. And all these sessions will come along with some discussion, some time for discussion. So just, if you have any issue, just keep them down. We'll be having a time to discuss them. And finally, we'll have Dr. Lamont Patrick Louis. He is the cross-border focal point person, IGAD and EU, in support of the COVID-19 response project. And he will be presenting on a case study of border health management in Uganda. So without missing words, I would want to call upon Dr. Kojo Asamoah-Kwesi, who is a Senior Research Fellow, Immunology Department, NMIMR, who will be taking us on the contribution of African higher education to the effectiveness of our health systems in managing pandemics. Dr. Kojo Asamoah-Kwesi, can you hear me?
Yes, Narajuman, yes, I can hear you very well.
Excellent, Dr. Kojo.
Yes. Good morning, everyone.
So, good morning to you. Great. So you're lighted up. That's wonderful. So glad to have you join us this moment. And everybody on the continent right now is watching and listening to you to take us through on the role of higher education towards the effectiveness of our health systems in managing pandemics. You ready?
Yes.
Take us.
So let me share. Can you see my share screen?
Clearly. Yes.
Very clearly. If you can put it on slide mode, on presentation mode. Yeah.
Yeah. Oh, sorry. Okay. There we go.
Splendid.
Yes. Okay. So good morning, good afternoon, wherever you are in Africa. Welcome to this session. So I'll be speaking on the topic, the effectiveness of, sorry, there's something off. Yes, so effectiveness of the African health systems in managing pandemics, that's a theme for this meeting. And I'm looking at the role of higher education institutions. So as has been mentioned, I am Kwejo Asamoah-Kwesi from the Noguchi Memorial Institute for Medical Research at the University of Ghana. I will try and do this very quickly. So for a start, this will be the outline of my talk. I would look at Africa's disease burden and how our health systems are, very briefly, just on 1 or 2 slides, and look at generally when we say preparing for pandemics, what goes into that. And then I'm going to use my institution as a model institution for discussing how we have contributed to the health systems, not just in Ghana, but across Africa, in these various areas in terms of research and surveillance, in terms of training and capacity building, and then have some concluding remarks, and that will be something that will generate some discussion. So to start with, Africa, as we all know, has a very high burden of infectious diseases. We have, if you go across the African continent, HIV/AIDS is a big problem, malaria, definitely a big problem. And these are just the traditional diseases we know, tuberculosis and all that. And then if you look on the left, we now have the emerging and re-emerging diseases. This is showing a global picture of how that scheme also is. But if you look across Africa, we have quite a huge burden of these diseases as well. Currently with Ebola, causing havoc in Uganda as we speak. And then beyond the infectious diseases, we also have a rising prevalence of non-communicable diseases, so cardiovascular diseases, diabetes, cancers, and these are all going up. And this is unfortunately all happening on a continent that is also supposed to have the weakest health systems in place. And if we look on the side of prevention of diseases, and I just talk about vaccines for that matter, we are looking at a continent that has just a handful of vaccine manufacturers or vaccine makers. Across the African continent, we have just a little under 10 of them. But it is only one actually that does significant production, Senegal, making yellow fever vaccines and is able to export this outside Africa. So most of the other sites really until, and this is up to about 2020, 2021, are mostly doing fill and finish of vaccines on the continent. Now, Africa is said to consume about 25% of all vaccines made around the world. Okay, and we unfortunately make less than 1% of these vaccines on the continent, and this represents a very significant vulnerability that we have as a continent, and also, highlights our over dependence on other countries and continents for our supply, and this is something that needs to be reversed very quickly. Now, generally, when you're looking at pandemic preparedness, there are certain core elements that go into that. So first of all, mitigating and preventing the pandemics from even arising. So what plans are put in place to even make sure that diseases that would result in pandemics do not even happen, okay? So those are usually the first points to look at, mitigating and prevention of disease from spreading. Then preparing for the pandemic once it arrives by itself, how or what goes into you preparing to handle pandemics. How is the response to the pandemic going to be? And post-pandemic, how is recovery going to be undertaken? And embedded within these 4 core elements are things like how you communicate and engage with communities, because you're looking at pandemics affecting society, affecting populations, and management of communication is very, very important. Otherwise, you end up even creating more problems than the pandemic itself is causing. There is need for continuous education. There is need for stakeholder identification. Pandemic management involves having multiple stakeholders, each one contributing in a complementary manner in order to bring about solutions and to bring about resolution. So identifying stakeholders, and usually this comes from the health system itself, is very critical. Having simulation exercise is very critical. And then also having, sorry, something is blocking me. Yeah. Okay, so, and one other thing also is about establishing surveillance systems, disease surveillance systems, so that you'll be able to track what is happening in order not for them to get to pandemic levels. So these are very core elements of any health system that is preparing to handle pandemics. Now, what can educational institutions do when we talk about pandemic management? And I've just listed some of the key things that educational institutions can, contribute to pandemic resolution. And this includes, for example, integration of these educational systems into existing health systems to support them in terms of public health response and delivery of services that would aid the response. 2, having research that will go to support product delivery and discovery, as well as product development. This is very key because when it comes to things like drugs, like vaccines, educational institutions have a big role to play. And now I'll show that on later slides, what educational institutions have to do when it comes to providing this kind of support for pandemic management. Training of public health and R&D experts, that is a very critical component. Universities, higher education institutions are supposed to give training anyway. So having specific training that will feed into public health programs is a very key function of higher educational institutions. Support for national health delivery systems, having specialized diagnostics, having disease surveillance systems in place. And these are all aspects of a preparedness plan that higher educational institutions can support. And of course, very important to all of this is having a social angle to all of this. So this is not all looking at just sitting in a lab and doing something, but also having a social angle to it. Public engagement in research. How do you get people, for example, to sign up to do clinical trials? You need to understand their psyche. You need to understand how communities are locally run to be able to do this. Risk communication. How do you communicate information about dangers of pandemics to societies? All of these are areas where higher educational institutions can help to mitigate the effect of pandemics. Now, I'll focus on what my institution is doing as an example to what higher educational institutions can contribute to pandemic management. Now, the Noguchi Memorial Institute for Medical Research is part of the University of Ghana and sits under the Ministry of Education, but has all these partnerships and links with the health system, starting with the Ministry of Health, the Ghana Health Service disease control programs, various disease control programs. We have partnerships with various regional and international bodies, WHO, the West Africa Health Organization, Africa CDC, the US CDC. Partnerships with regulatory bodies locally, so with the Ghana Food and Drugs Authority, with the Ghana Standards Authority. We have a number of collaborators and funders who support most of the things we do, and that will become evident as I go through the slides. Our partnerships with private labs and industry And in these two areas, that's where we've worked mostly with industry and private labs, sterility testing, product evaluation. In the post-COVID era, we've also been engaged in training over 40 labs in terms of testing for COVID-19. And then we also have our mandate of training and research, and of course, the collaborations we have with other government institutions and other constituents of our own university. So this is basically the partnerships we have, and this is the mandates of the Institute. One, to conduct research into communicable and non-communicable diseases. Two, to provide training opportunities in biomedical research for students. And three, to provide high-end diagnostic support to support the national public health system. So this is the three core mandates of the Institute. And on the basis of that, of the 9 research departments that the Institute has, each of them is integrated in a way that supports the health system. Okay, so we have 9 departments, each of them having either some sort of reference lab that is either recognized at the national, regional, or global level, as well as support units that provide services that feed into what the other units do. So we have a very good integration with the Ghana health system, with the African health system. And as I go through the slides, that will become very evident. So I'll focus on research and surveillance, first of human diseases. And I'll just present a slide each on these. So we have a disease like Lassa fever, which is very common along the West African coast. And in Ghana, the first cases of Lassa fever through monitoring was picked up in 2011. This was confirmed elsewhere. And then in 2015, there were 2 cases that were picked up in peacekeepers returning from Liberia. And then, of course, with sampling of animals in communities, you have picked up or shown that quite a significant portion, almost 27% of rodents from various communities in Ghana picked up, showed exposure to this virus. And I put this up because this is where you begin to, ensure that you are actually putting yourself ahead of the disease and not waiting for it to break out as a pandemic. So going out looking for this disease before it hits as a pandemic. And then in recent years, sorry for this slide, in recent years, we have the monkeypox cases that are coming up, and surveillance for this in-country has so far brought up 18 confirmed cases out of over 132 samples that have been tested as suspected cases. A lot of these in children under 10 years, and this is very good information to derive out of the data you're generating, because it shows you the demographics that you should focus on a lot in terms of control. And we have 87% of them showing the typical signs of the disease. To switch gears to come to COVID-19, in terms of diagnostics, this is a table that is showing how much diagnostic work has been done in Ghana. So comparing what has been done at the Institute with what has been done in country. As at the end of 2020, so Noguchi was actually testing just about half of all the tests, or was doing about half of all the tests in country for COVID-19. And by the end of 2021, that has reduced to about a quarter, so 500,000 tests out of 2.1 million, but that is still quite a significant amount just for the single institute to do. So we have been heavily involved in COVID testing in Ghana. And like I said previously, when COVID broke and we started testing late 2019 into 2020, there were just 2 labs, so Noguchi and KCCR at Kumasi, that were involved in this testing. But currently we have close to 50 different labs, most of them trained by Noguchi to be able to do this testing. So that is building capacity for quickly and rapidly doing this, because I remember in the beginning, there was so much stress on the Institute that it was difficult coping with the numbers of the cases. And then if I switch gears to surveillance, so for sequencing capacity at Noguchi through the help of Africa CDC and the WHO. Noguchi has put in place quite a good sequencing facility and also high-speed computing facilities that are deployed for sequencing, mostly for COVID, but also for a lot of other diseases, as we shall see. Now, there are a few labs around Africa that are designated as sequencing hubs, and Noguchi is one of them. Sequencing for the countries listed here, so Togo, Benin, Liberia, and Sierra Leone as a reference lab for these countries. And so far, these are sequences that have been done for COVID over the period since March 2020, when the disease was first picked up in Ghana. So in country, a total of 1,200 sequences generated, and internationally, just about the same number of sequences generated from COVID sequencing. So this resulted in us knowing or being able to track this. And I must say that another institution at the University of Ghana, which is the West Africa Center for Cell Biology of Infectious Pathogens, has also been very, very instrumental. Also has a very good sequencing facility that is also doing this. But through this sequencing facility, we're able to pick up the changing patterns of the variants that we have in country. This is us at the end of January 2022, but I can confidently say that as of now, Omicron is still a big challenge, and most of, or almost all of the sequences we're seeing currently still belong to the Omicron variant. Then there is also what is, there is also environmental and animal work that is done in order to get ahead of disease, okay, to be able to track what is happening in the community before they break out into epidemics and subsequently into pandemics. So Noguchi works once again with the Ghana Health Service, with the Ministry of Health, as well as the Ministry of Food and Agriculture and the Veterinary Services Department. And in almost all 16 regional capitals, there are sentinel sites where samples are constantly picked for diseases such as TB, for polio, and also for viral respiratory pathogens. So to look at a few of these, for influenza, there is surveillance that is ongoing in these sentinel sites, and as cases are picked up, they are brought to the labs for sequencing, and the information is fed into regional and national systems for decision making. Along this is also environmental sampling, where you take samples from animals and also from the environment, and this is also being done in conjunction with the Ghana military. This is work that is supported by the US military to do troop education, so educating the military troops on how to take the samples so that they can bring these to the labs for analysis to be done. And the focus is on troops because they go out, come in to go out to various places around the world and come back in. And like I showed earlier on, there was an instance where Lassa fever was brought in from Liberia at some point. So this is to track specifically influenza, but there are other activities that also track other diseases from such sources. And then we have, for polio, also environmental sampling to look at what is out there. And like I said, all of this is to get ahead of knowing what is there before you have outbreaks and be able to control them. So for polio, we also do surveillance for some of our neighboring countries, and this is showing the numbers of samples that have been analyzed for both Ghana and our neighboring countries over a period. It is looking at both the wild type polio virus as well as the vaccine viruses, and both indeed have been found even in the environment, and that indeed informs decisions, for example, like the polio vaccination that is currently ongoing in Ghana. So there's both human sampling and environmental sampling so that we'll be able to know how the disease or the viruses are moving around. And then there is monitoring and surveillance for mycobacterium. So this mycobacterium bovis is supposed to be an environmental pathogen, but we, in surveillance, begin to pick this up from abattoirs, okay? When animals are slaughtered and you look in the organs, we are picking these lesions that look like tuberculosis lesions. And indeed, laboratory analysis confirms that about close to 50% of these are actually tuberculosis lesions that we find in these animals. So this already begins to tell you the chances of transmission of these from these animals to humans, either through handling at the abattoirs or through consumption of the meat. And already you begin to pick this up and plan ahead in terms of how to handle this and not let them end up being or entering a pandemic form. And then there are also programs in antimicrobial resistance, looking at tracking bacteria, especially that are resistant to readily available antibiotics. And some of this work led to the development of national policies around antimicrobial resistance. And that work is also very key in terms of understanding disease and tracking infections. And then there is also work that is ongoing to look at tracking the microbiome that you find in the environment from plant growing areas, looking at the plants themselves, the water that is used for irrigation, through transport of these to markets, and also sampling from the market to track what microorganisms are on these as they go from the farms to the markets, because they will definitely end up in people's pans and in people's mouths. So looking at what microbes you find in these places, or as the food is brought from the farms all the way to the market. So this is work that is also ongoing. And like I said, all of these are efforts to be able to go ahead and not let the pandemics hit. Now, in terms of vaccines, Ghana launched what you call the establishment of the National Vaccine Institute, getting close to 2 years ago. It currently exists as the Presidential Vaccine Production Committee with Prof. William Ampofo as the secretary. And the mandates of this National Vaccine Institute, when it is fully formed, is to establish local vaccine manufacturing plants locally, to deepen research and development efforts in vaccine, and also to ensure that we get to some self-sufficiency in terms of vaccine production. And the first vaccines are expected to be made sometime in 2024. Unfortunately, fill and finish as the case will be. But Ghana, for example, is expected to be weaned off Gavi support by 2027. So this is really a good plan to be able to ensure that by that time, we would be in a position to take over taking care of ourselves in terms of vaccine production. So if you look at the mandate of the National Vaccine Institute, there are two key points where research institutions will play a very vital role, and that is in terms of research and development and human capital development. In terms of research development, having the capacity to understand the pathogen biology and to discover what would be good candidates for making vaccines, for performing immunological assessments and determining immune correlates of protection, and also capacity for preclinical and clinical studies. And on the side of human capital development, building the human capacity that will be needed for the manufacturing market, and also building capacity for R&D, as well as refresher courses and programs for practitioners in the vaccine manufacturing space. So these are key targets that research institutions like Noguchi are expected to play, or roles that they are expected to play in order to make this happen. So back to what is available at Noguchi, there are quite good labs at BSL 3 and BSL 2 levels for handling different kinds of pathogens. And this is very essential for discovering or for product discovery and also for understanding the biology of the pathogens and being able to find weak points where you can target for both drugs and for vaccine development. And then there are also clinical trials capacity. Currently a dedicated facility for clinical trials to handle phase 1, phase 2 trials in-house, but phase 3 trials community conducted, so in collaboration with various Ghana Health Services facilities across the country. But on site, there is quite a good system in place for conducting phase 1 and 2 trials. And then there is also a very good animal facility. It's just being renovated recently for conducting high-end research, animal research, so preclinical studies that will lead to drug discovery, and also for clinical vaccine antigen discovery. So these are all facilities that need to be available in research institutions to enable them play a significant role in developing or helping the health delivery system in terms of pandemic management. Now, there is also capacity building in terms of programs. Okay, so universities basically are supposed to be doing teaching and research, and in this area, there is also need for universities and higher education institutions to play a role, and there is already quite a significant role in terms of training that Noguchi does. Other constituents I know also have similar programs taking place. So training of laboratory staff in disease diagnosis, establishing laboratories for infectious disease diagnosis, and a lot of these have been done with help from various funding bodies. So I just pick on 2 specific examples. This is a workshop that was supported by Africa CDC and AfroScreen to train participants from 10 different countries on next generation sequencing. And this was done February this year. These are some of the participants from that program. And then just last week, we ended another training program that brought countries, a person from another 10 countries to train in enhanced laboratory skills for infectious disease diagnosis. So looking at the very traditional diagnostic methods to the more current diagnostic methods, including molecular methods. This activity just ended last week and was supported by JICA. So these are just 2 examples of many other hands-on training that higher education institutions can provide for the health systems in order to prop them, because all of these participants really came from national health laboratories in their countries. So these are pictures from those trainings. And in terms of specific program development, we are currently also developing 2 to 3 month additional 2 to 3 month short courses, and then also maybe 2 to 3 week taught courses, classroom courses that would enhance the capacity of health professionals. And in addition to that, also looking at developing, this is more in response to the pandemic now, developing courses in vaccine biotechnology, One Health, and in tropical medicine. So these are in the process of being developed as new additions to our already existing programs. So to round up, I would say that what African institutions need is to develop in these areas. Most African institutions have some existing capacity, but we need to be able to build up this capacity even more, to be able to develop additional programs that will train the critical workforce that is needed for pandemic management. There exists some capacity now, but we really need to leapfrog and train a lot more to fill the spaces and the gaps that we have in our health system. And also to improve upon the capacity for training on laboratory skills, we need to have very good laboratory personnel to be able to manage or generates the data that we need to take informed decisions when it comes to pandemic management. Of course, improving and upgrading research laboratories and capacity, that is very, very critical. If we go around many institutions now, you see a huge lack of the needed infrastructure to be able to conduct high-end research. And I think it's time that African governments, came together to really resource their research institutions to be able to perform high-end research that will generate data for drug development, for vaccine development. And one critical thing is the establishment of biotech centers, which are very critical for translating what you find at the basic research level into products. That is very, very critical, and we need to have a lot of these across the African continent. We need to be able to promote and conduct research that has direct relevance to our own public health systems. If we go across the continent, a lot of the research that is being conducted is funded from outside the continent. And it is driven by the agendas of these funders, and we need to have a repurposing and a redirection to have Africa fund research that is needed by Africa. That is very critical. To develop partnerships that would improve our disease surveillance and monitoring systems. This is very critical. We need to be ahead of pandemics before they show up and not wait till we are in the middle of it and then we start running around firefighting. So we need to identify stakeholders, develop partnerships that will help promote finding solutions in a much quicker way. And then we also need to increase our engagement in vaccine R&D, basic research, preclinical, clinical research, even convincing African populations to be part of clinical trials. Sometimes it's a challenge. And we need to be able to find ways of getting around these so that we can play an active role in finding solutions to the problems that we have on the continent. So with this, I would stop here and say thank you very much for listening.
Thank you very much, Dr. Kojo Asamoah, for your very, very succinct presentation on the role of higher education in contributing towards effectiveness in our health systems. And, the very first issue that was noted in regards to your presentation came from the fact that you outlined the number of activities that higher education has to play: community and communication, community engagement, continuous education, stakeholder identification and involvement, stimulation exercise, and also surveillance. And the issue was, we want to find out the practical gains that we've made thus far on the outlined measures. Can you share some with us, please?
Okay, thank you very much, Ajiman. I think this varies across the continent. In some places, you have quite good engagement when it comes to all of these. In other places, some are more developed than others. One thing that for a long time we've neglected is how, as research scientists in the laboratory, we look at how to communicate what we're doing to the outside world. That has been lacking. And this is now beginning to sort of take shape across the continent, engaging social scientists to be part of what we would normally term a natural science endeavor. It's become very critical, and I can cite one or two examples, once again, from my own background. In Ghana, where in 2015, we had an Ebola trial that was supposed to happen, suspended because there was a lot of miscommunication about it. So this communicating what we do in the labs to the outside world is very, very critical. The second thing is in terms of sentinel sites and surveillance, and even with simulation exercises. These are things that sometimes we might not, be willing to put a lot of money into, because you say for most African governments, once the thing is not there, there is no need investing in it. It's very difficult convincing African governments, for example, to fund simulation exercises. Why would you want to spend millions or thousands of dollars just doing a drill? It sometimes doesn't make sense. But these are the things we need to do so that when pandemics and epidemics outbreaks happen, we would have people who know what to do. They already have the skills and know what to do, and then move in very quickly so that we don't have diseases going from epidemic status to pandemic status in a very short time. I hope that is okay.
Yes, it is. Thank you very much, Doc. And now I'll go back to the studio. Isabella and Imelda are ready to read out our participants' comments and questions to you. So, Bella, over to you back in Ghana. Isabella and Imelda, can you hear me? Hello. Sorry, we actually having a hard time hearing Bella and Imelda.
Hello, Mr. Jaman.
Yes, sir.
If I may read a question.
All right, sir. Go ahead, please.
Okay, thank you very much. This is a question from Mishek Gichoya to everyone, and she is asking, how has Africa developed its traditional medicines to complement the modern medicine in the fight against diseases?
That's a spot-on question right there from Mishek, and thank you very much. So to you, Doc, how has this been done from your perspective, traditional medicines to complement the modern medicines in fighting against diseases? Let's hear from you.
Yeah. I think we have a huge potential in traditional medicines, which is very huge, mostly untapped, and we need to start, getting in there and seeing how we can really utilize traditional medicine. It is said that over 80% in Africa, over 80% of people rely on traditional medicine anyway. But there are a few challenges that we have, a major one being standardization. Okay, how to get things presented in a standardized form. But we do have a very huge potential. And I know a few places around Africa where we have actually research institutions established just to look into traditional medicine. And I think we need a lot more of that, and to have a system where we can rapidly look at these, develop our own system of how to get these through or formulate and standardize these for use, because we have a very huge and, like I said, untapped potential in terms of traditional medicine. And I think it would be good that we put some attention on that and get it working.
Spot on right there. So you can also share your comments with us today on what you've heard thus far. We had a comment coming from Alex Bangura, who says that Dr. Kusi, your presentation is timely and significant, responding to the issue of the pandemic. Thank you very much, Alex, for your comments. So you also join in anywhere in Africa. You can also bring in your comments so we can read for you. What do you have to say? You have a question, you have a comment about the presentation, an inquiry to make? Kindly bring yours in and let's read for you as we roll on the program. And if you have a comment, you can just put your hands up, show us an icon, a hands up icon, and we'll give you access to also share your view by giving you the ability to unmic yourself, mute yourself, and also share your view. So we have one from Frida Okeyo, who's saying that, how did you measure the preparedness? That's a very good one.
It is, but basically, how do you know you are prepared? And the simple answer, I'm sure there will be multiple ways of doing that, but the simple and straightforward one I would say is, for example, what I mentioned about having drills, having simulation exercises. If you can sit in a room and plan all you want until you get to the field and actually go through what you have planned and know your response time, know your feedback time and all of that, you cannot sit in a room and measure your preparedness. So having drills, for example, is one quick way of assessing yourself in terms of monitoring the implementation of your preparedness plan, how fast you respond when there is an epidemic or when there is an outbreak somewhere. Having drills is very, very critical. But of course, there will be other ways of measuring that.
Okay, so we have got another one from Peter Otieno, who says that, can investing in food security in Africa deal with the problem of disease and ravaged continent? Can investing in food security in Africa deal with the problem of diseases ravaging the continent? What do you have to say, Doc?
Definitely. Food, nutrition, and immunity are very highly linked. If we take many diseases, even for HIV, if you have very good nutrition, HIV, although you are probably living in it for the rest of your life, you can effectively manage to live with it if you have good nutrition. Okay, so nutrition plays a very key role in terms of our bodies fighting disease. So solving food security alone will take away a lot of our burden. Okay, it might not get pathogens to just vanish, but regional security issue.
Great. So let's hear from some of our participants online. My very good friend Alex Bangura. Alex, let's hear from you. So Alex,
hello.
I can hear you, Alex. We hear you.
Okay,
let's hear from
that
you.
was African universities, but I will ensure that I communicate with colleagues. And I know the EBK University and by Kruma University as part of the AAU, and also my college, the Institute of Petroleum and Management, is part of it. And that will help improve a lot. That's my submission.
Thank you very much, Alex, for your submission. Also, I accept the charge on behalf of the AAU to ensure that we keep the education ongoing, all right?
Yes, absolutely.
Great.
Absolutely.
So, Ojob Charles Oye, I can see you. You're on. Unmute your mic, please, and then let's hear from you, Charles.
All right. Good afternoon, members.
Good afternoon.
Hello, can you hear me?
Yeah, perfectly, Charles. We can hear you very well.
Hello, can you hear me?
I can hear you.
Yes, I can hear you.
Yeah, we can hear you.
Okay, fine, thank you. I'm Ojob Charles Oye from Uganda. I have only one question, but before I ask the question, I would love to appreciate all the presentation and deliberation made by all presenters. Thank you for the wonderful presentation to us, the listeners and the audience. I have one question which I would love to get to know from the organizers, that what are the possible measures or ways which can help the Africans to have their own medicines in order to curb the outbreaks of the pandemic? Thank you very much.
Dr. Kojo, I believe that Charles has had enough of, let's say, orthodox medicine, and he wants to know how are we trying to give traditional medicine a huge stake in our health system? What do you have to say to that, Doc?
Yeah, I think it's related to an earlier question also. I think we need to develop systems and standards for making these medicines. One, we need to engage in research still. I mean, there is a lot of folk knowledge on traditional medicines, but we need to begin to formalize some of these and to mainstream them such that wherever you are buying whatever product, you are assured of its quality and the job that it can do. Researching into this is very critical, because it is out of that that you are able to get standardization. And I say research because, sometimes in Africa we say, oh, this is from plant origin, so it is good. It is, it doesn't have any side effects. But that is not true. Some of the most poisonous agents come from plants. So it's a matter of being able to sort out what is good from what is not good, and then formulating the good parts for our use. So I think we need to, one, engage in studying these things a bit more. And you know how our systems are structured. In folk medicine, when someone has an idea what this and that plant, when you combine them, can do, they want to keep it to themselves. We need to begin to break those barriers and to be able to have the knowledge more or less formalized, so that we can have products that you say, this works for this. And yes, truly, no matter where you get it, that is what you and product you get from.
Very well. Very well. And I will now move to Bello Mihinat Bulanle. Bello, you can hear me. Just for you.
Thank you very much. Good afternoon, everybody.
Good afternoon.
Presenter. It's a good presentation. My own is just a contribution. I want to look at it because the paper says or hammer something on the role of higher education. And from my own perspective of higher education is institution of higher learning. And there is a particular unit which we call teacher education program in every university. Teacher education program produces teachers that takes this education at all levels. So mine is an observation or suggestion that we can also look at rebuilding the curriculum of this teacher education to be able to produce teachers who are health conscious, full knowledge of what is a pandemic and whatever that may be happening in any society. So if they are well cultured, well knowledgeable and versed in this, they can now go to in the field of practice in the teaching profession at primary school, secondary school, and the teacher education program. It can be useful. This will help a lot in preventing pandemic, because we only experience what's it called, COVID-19. We are not sure, and we don't know what will come up in the next future. Maybe another one, or don't pray for it. So we have to have a room for prevention. And prevention comes through, we made a lot of advocacy, the shouting, the enlightenment program. Enlightenment program comes later when the COVID was around, and that was the main issue. So we need to be prepared. Prepare the mind of the young ones, because shaking hands, using nose masks, that one came later. Let us use this as a learning, the lessons from the experience of COVID, imbibe or inculcate more education program into teacher education training. Go through the curriculum, like in my university and in my own unit of Faculty of Education. We have just a course that is general for all education students at 300 level. And that is health education. And after that, none. And they spend 4 years or 3 years or whatever in the program. So they should have more. Thank you very much.
Thank you so much, Bello. Well said. Well said. We have lots of comments coming in at the moment, and I'm telling you that we're going to attend to every one of them. So let me just take a couple of them over here, and then we'll do a quick break where we'll bring you the radio drama that we wanted to bring you earlier on for you to appreciate, and then we'll continue. So let me just take some from Eric Patterson, who says, are we dictated to by the big pharmacies, so we always buy from them, thereby keeping them in big businesses or big business? That can be noted down, Doc. And then we can also have from Gloria Pumfoa. Pumfoa says, good afternoon, I'm Gloria Pumfoa from University of Mines and Technology. I want to know if COVID-19 is still with us or is gone. So we have two of them. Doc, let me just add one more so you do a thorough for us. This from Victor Steven says, I'm a clinical psychologist. How can clinical psychologists come into research, or have you considered clinical psychology models essential in your research? So, Doc, what do you have to say to this?
Okay, thank you very much. And I'll start from the last one. I think definitely there's a role to play because, as I mentioned, even when you want to go into a community and say, oh, after I've gotten through all your regulatory approvals and you go into a community and say, oh, we want to perform and take this study in this community. You can have agreements for 99% of the persons you interact with. Just one person can derail your whole activity. Okay, you need to understand the psyche of people. You need to understand how people relate to some of these things and be able to, you know, get them to come along with you so long as you have a good cause. So, and in this era, you're promoting multidisciplinary research. Sometimes even when you're the one originating the research, you do not know what role someone else can play. Probably just talking to them will bring up an angle that probably you have not thought of, and that will be complementary to what you're doing. So definitely various fields in clinical psychology will be very critical in terms of things like community engagement and how you interact with people within a research setting. If I take the second question about whether COVID is still around, the answer is a big yes. It is still very much around. You know, we have a situation where it's a disease that is global. Okay, so even if in a particular country, your cases go down by so much and you relax your system, there is every likelihood of a reintroduction. It might take some time for this to completely die out. That is, it would have a scenario where this becomes seasonal, where every year around some time of the year you would have cases going up depending on human activities. So COVID is still around, and in Ghana now we're beginning to see a rise in cases. I think for the last 3-4 months it was a bit on the low, but now cases are going up again. Not that many people have ended up in hospital, but cases are going up. I can count in the last 1 month how many people around me have gotten infected. So it is still around. For the first question, whether Big Pharma is dictating to us, it's a matter of numbers, really, and who has the big pocket. So they are working in their interest, and we need to start also thinking about our interest. Okay, if we always want to rely on them, we have to help ourselves. Okay, it is when we are not helping ourselves that we begin to rely so much on them. If we arise and say, let us help and build our own systems, some of these over-reliance we can help to navigate through. Let me just give you an example of an instance where this is not about pharmaceuticals, but it's in the same arena. An instance where out there they would say, we are not buying your product for this and that reason, and then that causes you to reduce the cost of or the price of what you are selling by so much, and then they end up buying it anyway. But just not buying because you don't have another market. We need to start building systems that will ensure that we are self-sufficient. That's very critical, because you cannot look at someone else bit or gain from any interaction or transaction. Yeah. Great.
So I'm just loving the energy from our participants. I mean, kudos to you participants all over the continent for your involvement thus far, your contributions, your comments are just overflowing. And we have them all lined up over here to share with the various speakers for them to answer them. Be satisfied and also be very well aware of what's happening. But now we have one of our speakers ready in the person of Lamont. So back studio team, we're bringing on board to help us with his part. Lamont, Dr. Lamont Patrick Lewis, the cross-border focal point person with EGAD and also EU in support of the COVID-19 response project. And he'll be taking us through briefly and more insightly about the case study of border health management in Uganda. Lamont, Dr. Lamont, can you hear me?
Thank you very much. I can get you clearly, loud and clear.
Great.
Yes. Good afternoon, members.
Good afternoon, Lamos.
You could enable me to share the screen so that we get started.
Absolutely.
Yes.
It's been done, sir.
Okay, let me try. Just give me a minute. Otherwise, as I try to get the screen on, I am called Patrick Louis Lamotte, as has already been said. I am the cross-border focal point person supporting the COVID-19 response under the IGAD EU. This is an intervention of the 8 member states under IGAD. That is the Republic of Uganda, South Sudan, Kenya, Ethiopia, and Djibouti, among others. So the mandate was just to respond within the member states, especially at the cross-border levels where we are having lots of challenges. So from that time of the COVID pandemic to date, a lot has been done under the IGAD EU support. So, and that is what is continuing. So my experience draws from that, how the IGAD and EU merge with the member states, ministries of health, to undertake border health surveillance and prevent further spread of diseases across the member states. So that is what precisely I am going to take us through in this short presentation. So, just a minute. Can you view the screen now?
No, please, Doc. How's it going with the screen sharing? You've been given the co-host rights.
Okay.
Yes.
Let me see. Screen sharing. Okay. It is not coming. You can now see?
We can see it loading on. Yeah, it's now on.
Okay, Tata.
Thank you.
Thank you.
So I was just trying to give that brief background. My field, as I can say, I'm of the public health background. I was baptized to be a doctor, so very soon I should work towards getting the PhD, and I get with the support of AAU. So what I'm looking at, I give introduction to the border health management. So by definition, the border health management refers to the facilitation of authorized flows, including business people, tourists, migrants, refugees across our common border. So in the context of the functionality that we take at the border, we look at regulating and facilitating the fast movement of people safely through our borders. The measures to manage borders include the imposition by states of visa requirements, carrier sanctions against transportation companies, irregular migrants to the territory, and interdiction at the sea. International standards require balancing between facilitating the entry of legitimate travelers and preventing that of travelers entering for inappropriate reasons or with invalid reasons. So at the borders, the key characteristics that we see, one, it's characterized by mobile population, animal or birds movement. You see they are taking birds to the neighboring country, others are coming into the country, and so forth. So that very point makes the borders prone to multiple public health threats, including the COVID pandemic, because of the flexibility of people to move across. So from one source to another, where the entire globe can be paralyzed, like the way COVID did it to us. We also see that at the borders there are presence of several dealers, people doing different interests at the border to earn a living. Then also we see that there is a lot of complexity and dynamic nature of the border activities, which is very hard to understand. Then if there are facilities at the border, then most of them are not properly equipped. This is what we really saw coming out very clearly during the COVID-19 pandemic. I saw in that map, I'm just trying to give a picture of the border communities. There's South Sudan, there is Kenya, there is Ethiopia, and so forth. So the movements crosses from one country to another. And within those, there are peculiar characteristics. They are the same units, say, in this South Sudan, and their relatives are also here in Uganda. So the coming of COVID brought us, how do we manage such characteristics of border communities, which are unavoidable? You cannot stop a man who has one wife across the border from crossing and then restrict him on this. Others go for study reasons and so forth. So in the context of disease spread and in light with COVID-19, so we saw that in today's tightly connected world, the disease can be transported from an isolated rural village to any major city in as little as 36 hours. When the case was first announced in China, most African countries or other countries thought it would stop there, but within a short time, it had crossed the borders through the flexibility in movement. So, I will now take us to understand what are the role of Ministry of Health in disease management. So, in Uganda, Ministry of Health is responsible for planning, delivery, and maintaining an efficient and effective healthcare delivery system, including preventive, curative, and rehabilitative services in a uniform manner. Within the country, there is an established proper structure from village up to national referral level, and has always responded very well to any emerging pandemic. Now, the case bringing is the border point. Countries were concerned with establishing health centers in districts, municipalities, or whatever you call it, the administrative units, but they did not have the plan of how do we go about in case it is something of global nature. So, to complement what the ministries of health are doing, through WHO, member states endorse the international health regulations, which provides minimum standards that member states should uphold to prevent and respond to international spread of disease, so as to avoid unnecessary interference with international traffic and trade. Now, with the coming of COVID-19, we saw that member countries in your different localities responded by saying, let us close the border. But that was against the international health regulations of promoting timely movement of people through the common borders. So, observations that I can make during the COVID pandemic, we saw that some policies did not factor in people's economic status. E.g., upon coming, people were sent to quarantine centers. Sometimes they could hardly afford. So, in thinking that we would solve the disease burden from spreading, countries closed the borders. But we saw that very many people, members of the country, who had no capacity or who had gone for short-term visit, could not afford to stay in the visiting countries. However, countries now say, let's think about our citizens and bring them back. So if you are coming back, you are subjected to quarantine, monitoring, so that they test you and confirm that you are free from the COVID virus before you are released to the community. And in that process, people were taken to places where sometimes they could not afford financially and the likes. So we saw that there was need to protect the need to protect the economy outweighed some restrictions. For example, through Uganda, Kenya, Ethiopia, etc., we had truck drivers who were allowed to continue trading as a norm. So we now forgot, we said let the economic aspect take center stage, and yet the people who were transmitting most were those mobile communities, the truck drivers were moving from place to place. Then we also observed that many partners or organizations came up with emergency response measures at the different cross-border areas in order to ease movement and facilitate trade and safe movement of persons. So we also saw countries arranging repatriation of nationals back to their respective destinations to avoid suffering. I already said some could be students who are in another country, but because the institutions were closed, they had to be brought back. So that kind of trap brought about by the pandemic exposed many people to sufferings. So immediate actions or challenges that came up due to the pandemic. We saw that all countries floated the international health regulations which they are signatories when the pandemic was declared. Transportation of dead bodies, if my other family stays across the border, is somebody dies, even me to get the body for a decent burial as an African culturalist became difficult. We also saw that cross-border communities, a person who stays across the other side but gets services from another area, became difficult, so distorting the social-cultural arrangements that were there. Now movements became restricted even for the sick patients at cross-border levels, and all the resultant consequences. You know that health is wealth, and health knows no boundaries. So the intention of the international health regulation is to see that if I prefer to get treatment in country A, I can go and get health treated in that country. But with the coming of the pandemic, that became impossible and very difficult. A lot of approvals needed to be got for even a person to be evacuated for further management, and that could have resulted into more stress, death, and the likes. So we also saw that there was a disruption within families. You find that the husband has been caught up in this other point, the wife is caught up, the children at the other side, and every intervention to keep them glowing as a family became quite difficult due to the COVID pandemic. We also saw disruption in the cross-border business and livelihoods. So people would freely move before the pandemic, but when the restrictions came, life became hard, and there was that kind of disruption to their normal flow of activities. So is it my thing hanging? Are you getting me?
Yes, we are getting you.
Yes, we can hear you.
Well,
Yeah.
with you.
So
Please, can hear me start.
okay, I can now go to the gaps that were exposed by the pandemic as far as management of the health of the citizens and travelers were concerned. So most countries, the case of Uganda, is still struggling to have structures to handle the border health management. Nowadays you have to present vaccination certificates or negative PCR certificates and other health requirements. But now you find that in most the structures are not yet fully in place. But COVID forced countries to respond with emergency measures to deploy part-time staff and part-time resources. So to date, most countries, in Uganda, for example, we are still struggling to have those structures normalized, actualized. Then the border health facilities lack fully fledged laboratory to handle timely testing. So with the coming of the COVID, we are taking samples. A case in Uganda, we had the central laboratory when the pandemic just started. Now, the point where I'm speaking from to that central laboratory is over 500 kilometers. Now, you would expect that I get the sample now, facilitate the testing, give the person the result. If he's positive, we subject him to further care by the case management team. So, because the laboratories were not established at proximity, we saw some lag and challenges. Now that could have costed some people their lives, it could have delayed and caused lots of inconveniences. Countries, I think, still lack adequate logistic supplies to run border health units. And in case of another pandemic, many will still struggle. So, we've also noted that porous borders hinder effective exercise of controls. Now, because of the need, the health requirements, delay and so forth, people tend to get other path to cross so that they can survive and meet the needs of their community. Then we have also lack of standby ambulance services at the border points to handle emergency referral. I live in the South Sudan-Uganda border, and we know that the facilities in South Sudan sometimes for people there who wish to cross to Uganda. But at that point where we had a lockdown and restrictions in movement disturbed the health and well-being, the first response to cases that needed referral across the border. So we also noted that the pandemic exposed the lack of enforcement of One Health approach at the border points. The One Health approach currently is now being fine-tuned so that the health department works with the animal health, because we have seen the close linkage between the diseases that affect the population. Some of them, or most of them, have their origin from the animals. So the fact that the animal health and then the human health were not properly coordinating at that point was well exposed the coming of the COVID. So as part of the problem solving to neutralize this, Ministry of Health in Uganda decided to create a border health management unit. Now, the objective is to serve as the first line of defense to protect the citizens and visitors entering Uganda against the spread of communicable diseases associated with cross-border movement of people, conveyance, baggage, cargo, and imported goods. So, we note that at the beginning, before the COVID pandemic, all those structures were not there, but are still coming up. Now, what lessons do we learn from this pandemic? So, we saw a number of lessons that we learned, but before that, the border management, the way it's designed, it's a multi-sectoral coordination and linkages. It has all the agencies within the country. For example, in Uganda, we have Ministry of Health as the lead agency. the police, immigration, and so forth. Then at the national and sub-national level, or districts, in the case of Uganda, the Ministry of Health coordinates all efforts to respond to any diseases. So the border districts, the districts like where I am, and then the immediate, has close collaboration with the counterparts across the other side of the country, that is South Sudan. Then at the border, the point of entry, there's the Border Management Committee that coordinates the multi-sectoral and joint collaboration involving the border health units and other POE agencies. So the design that is coming up to solve, to address in case of any upcoming pandemic, is to work through the border management committee, or coordinate closely with the counterparts in the neighboring countries and the national task force in the country, Uganda, for example. So we also saw that we borrowed a good idea prompted by IGAD, the EU, that we should have a joint border committee. Uganda gets their members, South Sudan gets their members. We sit down to discuss. We share surveillance information. We share whatever updates that are coming up in the member countries. So that is how the Border Health Management Unit is working. So key lessons that we saw. So the integrated border management requires cooperation among all competent authorities in an effective and efficient manner, which must be established at 3 levels. So within the country, across the border, and then with the relevant agencies of the neighboring countries. We also have the intra-service cooperation in the integrated border management. This refers to the efficient management of processes, information resources within agencies responsible for specific tasks. So this only tries to bring in the roles that the Integrated Border Management Committee would be performing. So one of the main lessons that we learned with the coming of the COVID, that there is need for airports, ground crossings, and seaports to have the following capabilities: medical services, inspection facilities, and conducive working environment. So as you can see, this person in the mask is trying to take the sample of a traveler, I presume, coming through the border. Then in the middle picture, we also see that there is an inspection facility in case of foodstuffs and drugs, etc. And then the next one is a laboratory that is for taking samples and doing the tests right at the border point. So that is one of the good lessons that we learned. So different countries need to have or develop capacity to respond to public health emergencies, such as having emergency plan, building it from the past epidemic management. So we saw that in countries we have cases of Ebola, we have cases of Marburg, we have other fevers, etc. So with the onset of this, we have learned a lesson to develop a public health emergency response plan, so that from that we can also push it to another pandemic that might come in case another hits the world after COVID-19. So we also learned that having medical services and quarantine points at border crossing would be ideal for screening, preventing the transfer of disease from one point to another, and then developing a first-line treatment to avoid, to give a preventive measure before they mix with the bigger population. So enforcing and applying measures to contain further spread of disease, e.g. testing on time, surveillance, and contact tracing. So as you see, this is one of the border crossings, the health facility that is established there. So that this small building contains a lab and then the offices where the surveillance team pick the samples, talk to the incoming travelers, and then the next one with the curtains there is where somebody can be isolated as we wait for further care and management. So with all the challenges that were posed and with all the key lessons that we have learned, we realized that there is need for central government support through the respective ministries to center response efforts at the border points. We can only succeed if the central government, the national ministries, coordinate. And this is not only the work of Ministry of Health, but all the interagencies. In Uganda, we had the interagency task force where the security, health ministry, agriculture ministry, etc. sit together and then come up with mechanisms. So by that, promoting team spirit should continue so that in case any pandemic hits us, we can be able to respond. We can also, like currently in Uganda, we have the Ebola outbreak, but the interagencies are really cooperating to see that they really work together. Then there is need to strengthen port health services to have more capacity to do timely surveillance and reporting. This includes having adequate trained personnel at respective borders to respond to any public health emergency. So at the beginning of the pandemic, it was quite difficult to share surveillance information. For us, in our border side, we are not so much connected to the team on the South Sudan side. But later on, with the continued working relationship, we saw that the sharing surveillance information on what is a public health threat there and in our country improved. And by that, we have been and we continue to manage so many of the public health cases from transmitting into the community. There is need to strengthen the testing capacity. So across the borders, we have realized that transportation of samples from the border point up to the central public health laboratory takes time and gives us more risk. So one of the key recommendations that Uganda has, and I see also our neighbor South Sudan, is that the testing facilities need to be positioned at the border points so that you get a sample and clear, segregate travelers who need the further case management and those ones who just need to be sensitized on preventive measures. Then, because of the threats of other public health events like yellow fever, COVID-19, etc., there is need to deploy vaccines at the respective border points. Now, when the vaccines are deployed, it safeguards. In Uganda and South Sudan, we see sometimes cases of measles and polio coming at the cross borders. So where the people come from sometimes will be far away from the facilities to get immediate vaccines. So once we have them at the border points, it will be easier to safeguard the lives of our children and then further spread of disease. Then one of the main one is embracing the One Health approach at the border points. So when you come to Uganda, South Sudan border, Namanga, or whichever border you can talk about, you would see that currently we all joint meetings and share information about challenges to the animal health, challenges to the human health, and then we devise appropriate means. So that is what really needs to be upheld in at the cross-border levels. I know this is beyond the academic institutions, but now this can be a learning point of how you can design a kind of short training regarding pandemic response to pandemics at cross-border points. Say it can be short courses or whatever design the institutions can come in, so that people get to know. Because very many, trust me, very many do not understand the operations at the border, and so making policies relevant to that and getting the skills relevant to that becomes hard. So there is need for regular risk communication and engagement of cross-border communities and travelers, because people come from multiple places, others places of risk, and they don't get to know what takes place at the national level. They do not get the information shared by the Ministries of Health and the health alerts that we are talking about. So we need to regularly communicate to them, so that as they move, they protect themselves and the host communities that they are going to. There is a need for partner mapping and teamwork with clear scope of intended health interventions. We saw that when the pandemic came, so many people came and say, I am going to support the response, I'm going to support. So most of them were coming and say, we are going to give personal protective equipment. So you find that 2 or 3 partners are giving the same item and leaving the core. So member countries need to design means of mapping out the partners working in their respective jurisdictions, and then see what they are actually going to do, so that we avoid duplication of tasks and resources. Then need for regular training to refresh the skills of border health staff and build their capacity to respond to all emerging public health threats of complex nature. We recently saw the monkeypox threat, Ebola, Marburg. We saw COVID-19. So all those, although they are generic, the means of addressing them are generic, but there needs to be an extra input to skill the personnel who are managing the screening, the contact tracing, the case management, and surveillance. Then we need to have functional cross-border committees to aid timely communication and knowledge sharing. In the case where I am, we regularly share communication, we do joint trainings when resources and permit, but also we learn a lot from one another, which gives us the practical skills to address the movement of diseases across the border. So for the cross-border committees to work, there is need for adequate budget allocation to support their activities. There might be handling referral cases from country A to country B, or country B to country C. All those need resources. And then, of course, keeping online and internet, and then executing some task. So all those need resources. So as I come to conclusion, we need to invest in research, training and development in responding to public health threats. We need to trust our own and support massively indigenous initiatives to address our health needs. We need early and continued preparedness in order to be equipped to fight any pandemic. There is need to embrace the One Health approach at the border points all through the countries. Now, the One Health approach, the common area of infection is the food that we eat, the animals that we slaughter. Sometimes they buy a kilo from Uganda, take it to South Sudan. They buy from South Sudan, bring it to Uganda. But when the quality and health of those animals are not checked, diseases can easily spread to our innocent communities. So the photograph that you see appearing, there is an ongoing meeting, emergency ministerial meeting on preparedness and response to Ebola virus disease. This one is taking place right now in Uganda in response to COVID, to Ebola virus that is there. So within that, those are ministers, the director generals, the commissioners from the different countries sharing experience, and then we will see what to do. So these are the things that I said. it has been shared at the national level. That should be translated into the cross-border level, where the movements of persons and the safety, the first line of defense of every member country comes in. So once the meeting stops there and we don't translate it to the ground crossing, life will still be exposed to lots of risk. So thank you so much. That is what I could really briefly share with you as far as the experience about the cross-border health issues are concerned. I just had to summarize on that. Then I would want to chip in a bit. There was how are we giving a chance to African medicines to address disease burden? There was a question in the previous presentation. I want to give a scenario whereby in Uganda there was a local initiative that was developed, and it responded very well quite during this COVID pandemic. But what we only need to do is to trust our own, and then the governments support them as much as possible, the academic institutions, to do further research, and then we utilize the vaccines, which might be cheaper and convenient for us to get and use. Thank you so much.
Thank you. Thank you so much, Dr. Lamont, for your presentation. It felt like I was with you in doing border control, because your challenges were quite immense. And we around the continent also share the same plight with you. We look forward for a much more one health approach, as you mentioned in your submission, so we can be able to solve it out appropriately. So at this point, everyone joining us on this platform, we would have to give you a refresher. It is time to refresh you on your hours spent with us thus far with a very scintillating radio drama done by the COVID-19 diary here in Ghana for you to appreciate, for you to share. So let's do a quick one with the COVID-19 diary technical team back in Ghana, giving us a refresher of the radio drama on the variant of the coronavirus.
Hello, nurse, please help me. My wife has been sneezing, coughing, and finds it difficult to breathe properly.
Madam, please lie on the bed whilst I check your vitals. You shall be well, okay? You shall be well.
Nurse Lyle, where is the new patient? Hello, sir. What is wrong with her?
Hello, doctor. My wife just developed a high temperature and began coughing. She's now struggling to breathe.
Take it easy, my friend. I can see you already stressed. Kindly sanitize your hands. Nurse Lyle?
Yes, doctor.
Help the paramedics to transfer her to EMR2 immediately for the standard treatment and rapid tests. Give oxygen. By the way, sir, have you been vaccinated?
Yes, doctor. We had the Johnson & Johnson vaccine.
Nurse Lyle?
Yes, doctor.
Get her prepared for the COVID-19 test as well. Sir, please follow me to my office.
Okay, doctor.
Well, my friend, let me introduce myself. I'm Dr. Aluti, and I must confess that I'm amazed at your basic knowledge of the COVID-19 pandemic. Well, in these laboratory reports on your wife...
Doctor, please, what is the result saying? What is wrong with my wife?
Well, take it easy. I say take it easy. Well, according to the results of the tests, your wife unfortunately has contracted COVID-19.
What?
Well, this is what the results is saying. She was infected with the Omicron variant.
What did you just say, Doc? COVID-19, Omicron.
Yes.
I am confused.
No. She will be fine. Just don't worry. She will still be on admission for observation and treatment.
But doctor, we've been vaccinated and we've established all of the COVID-19 protocols in our house, which we follow every day. So how come COVID-19 and what's the other one you mentioned? What is that? Another disease?
I told you to take it easy. Well, Omicron is a variant of SARS-CoV-2. But let me take you to the public health officer. She'll throw more light on viruses in general and their mutation. I said, don't worry, okay? Your wife will be well.
Okay, Doc.
Hello, sir. Kindly have a seat.
Thank you, Doc.
Continuing from what Dr. Alute discussed with you, SARS-CoV-2 is the virus that causes COVID-19, which I believe you know already.
Yes, Doc.
Good. A virus cannot survive on its own unless it infects live host cells to replicate itself. And this replication happens in stages. It is during this stage that the virus mutates and develops into different variants.
I think I've heard about the replication stages from one of the COVID-19 diaries webinars run by the Association of African Universities. The first stage of a virus entry into the human cell is the attachment in which the virus's outside hair called spike protein binds to the host cell ACE2. I don't understand what ACE2 means, but I know it is something that is on host cell that opens up to receive the spike protein.
Oh, fantastic. Anything else you learned?
Yes, the heart of the virus, called the genome, which is RNA, then enters the cell following attachment, which is the entry and uncoating stage. In the instance of SARS-CoV-2, the host cell's ACE2 also serves as a doorway for the viral genome to enter and release its genome. Then,
Impressive. Gather your thoughts while I continue from where you left off. After entering the host cell, the RNA replicates itself using the ribosome, which is a molecular machinery located inside living cells. Did you learn anything about ribosomes?
Yes, Doc. I remember that. Can I hear more about this process?
The replication results in the formation of a new viral genome and protein. After that, the viral protein and genome are combined to create a new virus that is discharged from the host cell.
Oh, okay.
Yes. And there are actually two methods for a new virus to be released from the host cell. The first requires the death of the host cell, which is frequently performed by cytolytic viruses such as the smallpox virus. And the second method involves the budding of viruses with envelopes, which allows the virus to acquire a viral phospholipid envelope. That is lipid and protein. These are cytopathic and do not damage the host cell.
Interesting. What is the connection between virus replication and the variants?
This is a very good question, sir. During the replication process, sometimes errors occur as the viral genome and protein assemble. There is the potential for changes in its structure, its ability to affect, spread, and cause more severe illnesses and fatalities.
Oh, really?
Yes. And these changes are referred to as mutations. Variants are when the mutation of the virus becomes significantly different from the original virus.
Thank you, Doctor, for the explanations. I now understand how virus variants emerge as a result of mutations in the original virus. So, how many COVID-19 variants are there currently anyway?
There are actually several, but at the last count that I recollect, there are about 15 SARS-CoV-2 variants in existence.
Which which includes the Omicron variant?
Yes. But first, you need to understand that there are two kinds of variants. The variants of interest, VOI, and the variants of concern, VOC. Variants of interest have a higher rate of transmission. They are quite elusive to immunity or diagnostic tests and cause more severe diseases. A variant of concern, on the other hand, is more infectious and more likely to reinfect people who have been vaccinated or previously infected. It's also likely to cause severe disease, avoid diagnostic testing, and resist antiviral treatment.
Sorry to interrupt. This means Omicron is a variant of concern. Oh, Irama, what have you brought onto the family?
Sir, take it easy. She'll be just fine.
But where is this Omicron from? When did it come into the world?
Omicron, also known as BA.1, was first discovered in November 2021. Like I said earlier, unfortunately, it is more transmissible and causes more severe diseases. It has a higher risk of reinfection also. People infected with Omicron, regardless of vaccination status or whether or not they have symptoms, are likely to spread the virus to others. Your wife may therefore have picked it up from her workplace, the church, or anywhere.
Yes, the marketplace. That is where she picked the infection. What I don't understand is after taking the booster shots, I thought the whole family was freer. And we hear there is a monkeypox disease too. But tell me about the other variants of COVID-19. That should be of interest to me.
Before Omicron, there was Alpha, known as B.1.1.7, which is also a variant of concern. It was discovered in December 2020. Scientists estimate that Alpha is 70% more transmissible and has a higher death rate. COVID-19 vaccines are believed to be effective in preventing the incidence of hospitalization.
Go on, doctor.
There is also Beta, known as B.1.351, and is another VOC. It is approximately 50% more infectious than the original coronavirus and does not cause more severe illnesses. Delta, or B.1.617.2, was discovered in late 2020. This variant eventually became the dominant variant of the original coronavirus before Omicron was discovered. The Delta variant spreads more easily and has been responsible for more infections and fatalities globally. All current approved COVID-19 vaccines are safe and effective in preventing serious sickness and fatalities from the Delta variant.
Why? Why are these variants named with the Greek alphabet Alpha, Beta, Delta, etc.?
That's a good one. In May 2021, the World Health Organization began using the Greek alphabet to make it simpler for individuals to keep track of variants without connecting their names to the locations where they were first identified, as variants emerge anywhere and at any time.
Amazing. That is reasonable.
Of course it is. Back to the variants. Aside the 4 variants I mentioned classified as VOC, there are other variants classified as variants under monitoring, VUM, and variants of interest, VOI. These are the Gamma, Epsilon, Eta, Iota, Kappa, Zeta, and Mu variants.
I now understand why. Despite being vaccinated, my wife became infected with SARS-CoV-2.
This is exactly why even after vaccination, it is recommended to keep at least 1 meter away from others, wear a well-fitted mask over your mouth and nose, cough or sneeze into a bent elbow tissue, and clean your hands frequently with soap under running water, or alternatively with 100% alcohol-based sanitizer.
Thank you, doctor. I will be extra careful henceforth and continue to follow the COVID-19 protocols.
Excellent. Also, advise that you and anyone in your house do the COVID-19 test again, just to be doubly sure. Anyways, I'm Dr. Daniela Yeboah.
I am Nana Kofi. Right from here.
There we go. I think that you can put your hands together for the COVID-19 Diary team for the very, very wonderful radio drama they have recorded. I mean, the good thing is that Dr. Alice said Iroma will not die, so my wife will not die. I am Nana Kofi. I play the character, and it's so nice to bring this very special production to you all. Isabella, can you hear me back in Ghana?
Yes, I can hear you. Can you hear me?
So now, sure, I can hear you. So now let's take some comments. I believe our guests are all eager to get their comments on board and have them answered by our special speaker. So let's just hear from you on some of the comments thus far.
Okay. So there's a question from Monica Mayoni. She's asking, is it still mandatory for all Africans traveling to the West to get COVID-19 certificates to be allowed to travel? And she's also asking if quarantine is still in effect.
Okay.
So I think this goes to Mr. Lamont.
Yes. So we can take a number of them as the speaker who will be responsible to answer them will note them down, so we can have quite efficient Q&A session, right?
Okay. And there's also one 7. He's asking, do West Africa have this border model? If no, what is the plan? And there's this from Professor Ibrahim Chakala. He's also asking how to explain that some countries have eased to control of COVID-19 at airports, while others are still very rigorous. There's this from Matilda Sassi. She's asking, she's saying she enjoyed the drama and she wished it ended. Oh, it didn't end it. Oh, right. This is from Mishak. Mishak, right? He's asking, what measures did you put in place to minimize frontline officers against being corrupted by travelers who did not want to be quarantined? This is a good question. And also, to what extent can project anti-corruption systems be integrated into cross-border corruption? Yeah.
Okay, Bill. So
that is
great. We can put it here. Let's call upon Dr. Lamont, if you are with us. There are a number of questions that were directed to you. And also, we had some to Dr. Kojo. So if we can have your responses towards these questions and comments, please. It seems we may have lost Dr. Lamont. So we'll take comments that were related to Dr. Kojo, if that's possible, Bill. If you can reiterate these questions again so that Dr. Kojo can handle them, please.
Okay. Can you hear me?
Yeah, I can hear you. So the ones that were directed at him, Dr. Kojo, please.
A minute, please. Okay. This is from Lamo himself. Okay, he's asking, is African Union doing anything to improve health of African and respond to pandemic on their own? And I also wanted to ask Dr. Kusi, he made mention of they training people with via their workshop and the various workshops they've done. I wanted to ask him, when we are talking about our health system, we're talking about the people, the people who are delivering this healthcare to individuals. That is the nurses, doctors, and to improve our healthcare system, we need to get people who are professional, who are skilled, and who are determined. So, are you organizing this workshop? I wanted to ask him, how do they monitor? How do they get feedback from the participants? And how are they ensuring that whatever they've learned from this workshop is being implemented in various African higher education institutions?
That's a brilliant one. Very brilliant one. So, Doc, it's up to you. Let's hear from you, please.
Yes. So regarding the trainings, normally what happens, and with the last one I mentioned, the third country training, This is the fourth in the series, so this is the fourth year we are having that. And the structure is that the trainees always come from the public health system of their countries, so not just from any lab, but from reference labs in their countries. And they come here, they have the training, and then they go back. And sometimes you have some of the facilitators here who did the training being sponsored to go to these countries to follow up on how they are implementing what they've learned. This year, what also happened is that there was a platform for the trainees from the 3 previous sessions. So this group that came this year have been added to that group. And for each country, the number of persons who've been trained to come together to develop some sort of structured activity that would ensure that they become more or less like trainer of trainers, to be able to also pass on what they've learned over the years to others within other facilities in their countries. So there is some monitoring that goes on. It is not formalized, but from time to time we have people from here who are part of the training as facilitators visit these other countries to see how what was picked here in learning is being applied back home.
Great one there. This one for all our participants, everyone who has a contribution, a comment, you joined us wherever you are. Let's hear from you. What have you got to say thus far? So I have a lot of names, over 108 participants at the moment, and I would love to hear from every one of you. If not everyone, at least almost every one of you. Let's hear from you. What have you got to say? It's been a great presentation whereby we've had Dr. Kojo Kusi, we've had Dr. Lamont, and you should really listen to what they had to say about from the higher education point of view and also from the border control point of view. What have you got to say about that? So you can put your hands up, put the hand icon up, and let's hear from you wherever you are. We'll have your mic unmuted, and then we'll get to know what you have to say.
All right, Adiman, I think there's another question for Dr. Kusi.
Okay.
This is from Eric. He is asking, why aren't COVID-19 testing labs allowed to report CT values in reports to clients?
Okay. Let's have that.
Well, that's an interesting one. I know the reports that are issued by us here doesn't go with the CT values. I'm not part of the testing directly, so I might not be able to give a formal answer. But I think basically, even for scientists, it's difficult to even interpret that value. Okay, not many people would appreciate that, and its interpretation itself is such that you might, in my view, you might end up scaring someone, because the smaller the value, okay, the higher your viral load. The higher the value, the load, it can be a bit confusing, and that's how I see it. So I think it's just easier to probably just tell the person whether they are infected or not, rather than to put that there. But formally, I'm not sure why it's not given out. But this is my view personally.
Okay. Thank you very much, Doc. So Charles, let's hear from you. What have you got to say?
Hello.
Yes, Charles, we can hear you. We can hear you.
Hello, please. Can you hear me?
Yes.
Yeah. Greeting once again to every participants of this very exciting meeting. Yes. Hello.
Yes.
Yeah, we can hear you.
Go ahead.
We can hear you.
Okay, fine. Thank you. Mine is just a request to the organizer and some keywords of appreciation to all presenters. One, I think such kind of meeting should be organized at least, if not possible, if possible, then twice in a month, so that people should be aware of what is going on around the world. It is my first time, and it is something of very good of its kind in my life to have such an intellectual meeting with professionals in the health sectors. And if we continue with this, of course, Africa will be a different state. That's all from me. Thank you so much.
Thank you very much, Charles. I accept the chat once again that we'll make sure that we keep this program recurrent for the good of the continent. Thank you very much for your kind submission.
Thank you very much.
Thank you very much. And can we have some more, please? Some more comments. Some more comments. We have lots of people on the program. We have Blessing, Mwambe, Philip, Nyaswa.
I can see Lamont is back online. So
okay. Go ahead. Please go ahead. But I don't know. Before that, we have one hand up. Matilda Sassi. Can we hear for her, please? By your permission, please. Okay, so Matilda, let's hear from you, please. Matilda. Hello, Matilda.
Can you hear me, please?
Yes, please, Matilda, I can hear you.
Okay, yes. Good day, all. I just want to appreciate the organizers because this is not my first time. I have lost count of joining conferences by AAU. I think this is my 7th time.
Okay.
I can't count. And I've never regretted any. And in fact, this one I enjoyed most because I am writing my thesis on COVID-19. And there are so many things that I've not covered in my thesis, but through that drama, that is why I love the drama so much. I've gotten some things to add on COVID. I never knew that there were several others that came before the Omicron. So I have so much to include in my thesis. So I just want to say I'm grateful to the organizers. Thank you so much.
Thank you so much. We're glad that we were of help to you with information. Really appreciate it. So, Belle, you can quickly shoot in with Dr. Lamont for him to answer the questions that you have for him.
Okay, so Mr. Lamont, there's a question from Monica. She's asking, is it mandatory for all Africans traveling to the West to get COVID-19 certificates to be allowed to travel? And is a quarantine still in effect? And also there's one from Victor Steven. He's asking, do West Africans have the border model? If no, what is the plan? And this is from Professor Ibrahim. He's asking how to explain that some countries have eased to control of COVID-19 at airports while others are still very rigorous.
Yeah, thank you so much, moderator. Sorry, I had a mix-up of internet, so I switched my location a bit. I just want to go to the questions that were directed. I saw one was asking measures put in place to safeguard the frontliners, one, on their health, and then two, from being corrupted by the travelers, and then the other one is on the mandatory certificate, quarantine, and so forth. So let me start with the measures that are put in place. Where in my country, we had the bi-yearly test of taking samples from the frontliners because of their close interactions, so that in case of infection, we can manage them on time. Secondly, we had also put measures to counsel, provide counseling and guidance, psychosocial support to the frontline workers. As you know, you leave the workplace and go. Our place was at the peak. It was the climax, the epicenter of the infections, that if I left here and came to you and I mentioned that I am from this place, it had the biggest number of positive cases. We evacuated quite the biggest number. So people tended to fear. And by that, when me myself reached the community, they would fear interacting with me. So we had a lot of psychosocial support to keep them running. Then in terms of as the systems develop, as challenges come in life, human beings tend to get ways of survival. You heard in my presentation, I talked about porous borders. If they see that the restrictions of health and other agencies are too much, they tend to use the porous borders. Sometimes it's true they can corrupt and pass through the border agencies that are there. But in terms of health, they are trying to digitalize the processes so that we avoid the manual one, which is easier to corrupt. So that is what, if you cross the borders, we are trying very much, and that one came as far as the knowledge base during the COVID-19 is concerned, to address the challenges of people forging the results and so forth. Then somebody was asking whether there is still a mandatory certificate, need for a mandatory certificate as you cross borders. Yes, it is true, various countries, the pandemic has not been declared over. Until then, countries still continue to take precaution. So they have eased, however, the East African countries, they have eased it in a manner that if you are now fully vaccinated, you can be allowed to travel through the common border. If you are not, you will still be subjected to the mandatory PCR test that is required for one to enter, because you cannot rule out the possibility that the virus might still hit the world. So those communications are given respectively by the different member countries through the authorized channels. Now, in terms of the quarantine facility, we used to have quarantine and home-based care. When we saw that there were no places for keeping the travelers and at the border, people were encouraged to go for home-based care. But now, with the significant reduction in the cases across the country, the quarantine and the home-based care are no longer there. But continued surveillance still needs to be undertaken. Then there has been the big disparity between the airport and then the ground crossing. When you look at most countries, the airports are far much developed. They are more equipped with some of these basic facilities than the land crossings. But from the lessons that we got in this COVID-19 pandemic, our country, for example, is tending to move towards the strengthening the border health unit. I also see a similar intervention in Kenya, Tanzania, and then South Sudan, where I've recently crossed the borders. So I think there's the other one about the border health unit in West Africa. I want to believe that every country learned a lesson from the COVID-19 pandemic. And indeed, those structures are ably going to be set up if they were not yet there. If you travel, you will notice that the structures, you pass through the health before you get into the what? Into the immigration to get cleared into the country or out of the country. So if I've left any question, you can still ask and respond.
All right. I think you've done just all of them. We'll just pick so the four of you, Anika Nagusto Ayo, Philip Nyaswa, Francis Walugembe, and Alex Bangura. You can make your submissions very snappy for us because we've done so much time today and we would have to wrap up. So please, let's hear from Anika. Let's hear from you first. Then we'll do Philip, then we'll do Francis, then we'll do Alex, and we'll bring it to an end. Okay. So let's hear from you, snappy, so we can roll on.
All right. Thank you very much. Good afternoon, everyone.
Good afternoon.
I'm Augusta from Calabar, Nigeria. I'm really excited every time I get a notification for this conference. It has been a way for me to update myself. You know, being an academic in Nigeria, we've been out of school for the past 8 months.
Wow.
So this COVID-19 diary is actually very enriching for me and a source of education and updating as a microbiologist. So thank you very much. I particularly enjoy the drama series. You know, the way it summarizes everything it's easier to understand, and it's all very good. So I thank you for the commitment, for bringing this program regularly to us. Thank you very much. I really appreciate AAU. Thank you.
Thank you so much, Anikan.
Thank you.
We can also now move to Philip.
Right, thank you. I'm Philip Nyasa from Kenya, a small university, a young university called Uzima University, which is purely medical university. I must say that COVID-19 gave me networks at AAU. It was the first time I did a course with Professor Bafuo and Professor Darkwa, may God rest his soul in peace. It was very enriching, and you have held Africa together. There's no one who will come from outside to support us. Africa must rise up to support fellow Africans. I want to say that Africa has also proven to the world that they have some sort of resilience against pandemics. It had been prophesied by the West that they will be dying on the streets like frogs, like flies. There will be a graveyard. African streets will be graveyards. What needs to be done now is for African scholars to find out why Africans did not die so many as expected. Could it be genetic? Could it be what could be? What could be in Africa that made us so resilient and not as it was observed in the West? Thank you.
Thank you, Philip. Let's take a quick one from Alex. Let's please make it snappy, please.
Okay, I am Dr. Alex Bengrua, Institute of Petroleum and Management, CLU. I'm concerned about the corporate niche in all that we do. The presenter preceding this one mentioned traditional medicines, local herbs, and I'm looking at corporate politics in all of these. If you could recall, there was a time when Madagascar, they came up with something regarding the fight against COVID-19 as syrup or herb, and it was not allowed by, the pharmaceutical conclave. So that's the issue. And if Africa, universities in Africa should develop medicines and all other research in terms of fighting, it could be COVID or any other pandemic, then I'm afraid that their corporate politics has taken precedence in the pharmaceutical industries, and it's a concern. In as much as Africa is working towards that, towards Africa intercontinental trade fair, we are to take cognizance of corporate politics in all that we do in responding to those issues. That's my submission.
All right. So, the only thing that really makes it very sad is when we are out of time, yet we have lots of submissions to make. And at this point, I will ask that you forgive us. Of course, we are out of time, and yet we've seen so many hands risen. And I'm sorry, I will have to move on to the final bit of the program. All of the hands are raised can send in tests. I can send their submission through their test, and we'll do well to do that for them. We'll get it right down to the various speakers. I will now want to bring the program to an end as your moderator that's far supported by my team back in Ghana.
Ask my question, sir.
Okay, Francis, go ahead.
Maybe.
Yeah, I actually wanted to ask a gentleman from Uganda. I'm called Francis. I'm based here in Bangkok, but I also come from Uganda. I wanted to ask the gentleman who presented about the IGAD work, because we've been seeing recurrent outbreaks in Uganda, especially on cholera and Ebola. And I'm concerned about what are they doing to strengthen the health system, but also the surveillance system to ensure that these recurrent outbreaks don't continue every time and again, especially cholera in Hoima, Western Uganda, those crossing from DR Congo to this other part of the country. What innovations are they putting in place to ensure that those outbreaks don't continue reoccurring now and again. Thank you.
Yeah, thank you, Francis. I think he wants me to respond.
Yes, please.
Okay. Francis, thank you so much for that question regarding the recurrent cases of cholera and other public health threats. First of all, Uganda has a good model of managing such, in that there is normally the national task force, there's the district task force, and then there's that one based at the community. Using the village health structures and with guidance from the national task force, normally information is shared quickly. Once such a case is identified, the alert is sent to the center and necessary preparations are made. However, why they keep reoccurring is because of the high mobility of the people from different areas. So when a person comes from an infected source, definitely it has to manifest in another area. The conditions of living, for example, the squalid conditions through the DRC refugee seekers, temporarily when they gather, the health facilities and then the hygiene facilities get overwhelmed. So by that, it promotes a good environment for it to manifest and multiply. But as a country, I have observed that with support of partners, not only IGAD EU, there's the African Union, etc. When you saw the meeting, I projected the photo of people come together and discuss issues. What only at times delays is maybe the resources will not be got timely to respond. But the idea and then the skills are ably being developed, the surveillance structures and so forth have been fully functionalized. Thank you so much.
Thank you so much, Mr. Patrick. And I will call on Eric Patterson. Eric, your hand was up earlier, so you can kindly come back and then give us your submission. I'll take that as the last so we can wrap up.
Yeah. Hello.
Hi, Eric.
Yes. Good afternoon from Ghana. Okay, so I put my question on the page. I only wanted to ask how to deal with those who still think that COVID-19 is a hoax.
All right. So Dr. Kojo Kusi can handle this. Those who think that it's still a hoax. Doc, what do you think? What can we do for these people?
So it's a matter of education, really. And that's why you need to develop, systems that engage communities better. Some could be coming from, a background of, okay, I've not seen anybody die from it, or nobody around me has it. But, people get flu-like symptoms and you ask, have you tested? And they will tell you, oh, this is not COVID, it's just the common cold. If you don't test, how do you know? But the other, into them. We need to break this down well and get people to appreciate the fact that this is not it's not a joke. It's not like someone is sitting somewhere concocting this. It's a reality. So it's for me, education.
Okay, thank you so much, Doc.
Can I add something a bit, just based on the experience, that we saw in handling COVID-19. Number one, sometimes you'll need to give them to learn the hard way until when their family or they themselves are affected. That is when they will learn and change. However, we have tried mechanisms to really communicate timely and then advise on mechanisms to safeguard. Otherwise, over-politicizing of every occurrence is what makes really people think about that. But also, sometimes some people think when I declare that I am suffering from this, I don't have the resources. For example, to go to get treatment and so forth. So having that false confidence that I'll heal like an African without necessarily going for treatment should really stop. And that can only be done by the technocrats through continuous health education and availing the services closer to the masses. Thank you.
Thank you. Thank you so much. So at this point, I would do the honors and then give the vote of thanks. First of all, I want to thank Professor Lushola Oyewole, and he, as the Secretary General for the AAU, he has been of great support to the COVID-19 diary thus far. And I want to say thank you so much, Prof, for your support. With Ms. Nodimo Lamini, Director for ICT and Other Management, you are the one that holds us firm and going, and you have been also a great pillar for this program. Without you, there would have been no COVID-19 diary. So on behalf of the team, we say thank you very much, Ms. Nodimo, for being with us and giving us that pathway to move on. And also, I can leave Mr. Ransford Bequin. He has been the TV manager, always motivating, inspiring, and also empowering us to move ahead through the thickest times, toughest times. He's been with us. And I would say, God bless you. Thank you so much, Mr. Ransford, for your support thus far. And to the entire COVID-19 diary team, Isabella Tahenakwa, you are marvelous. I mean, without you, we wouldn't have had this COVID-19 radio drama. Your creative writings and your inspirations have been able to help us develop concepts to record these dramas that have been of great love to our participants today. Well done, Isabella. And Imelda, also for your support in research. Abigail, the producer, you've been immensely wonderful. Thank you so much for being with the team and also helping us with the contents. Godfred, you came in and you helped with publicity, helping out with promotional materials. You've done so well. To the entire technical team, Adam Hotel leading the team, thank you so much for pushing ahead with us. Thank you, Charles, for all the time you spent in mixing all these recordings. Thank you, Mike. Thank you, Isaac. Thank you, the entire technical team, all the mentioned, but all of you, all the masterpiece to ensure that we are live on TV and we are also live on Zoom. I want to say a big thank you to our special guest, Dr. Kojo Asamoah Kusi, for your time and immense insight that you share with us today on the program. Without you, it wouldn't have been a wonderful one. With you, we can appreciate the facts and the information. Not living, Mr. Lamar Patrick Lewis, you've also been wonderful, bringing us the information and also how it feels to be a border control agent, seeing to it that we are protected. And to our entire participants all across the African continent, you are the reason why we do this. And your comment today tell us that for each and every day, we should be thinking of what we will bring on board for you to appreciate and be able to carry knowledge on and on. So at this point, I would say thank you very much, every one of you, over 130 participants, wherever you came from. Stay with us for more of our information. AAU is informed. It's always transforming with information, and we will always stay charged to ensure that we bring you the best of higher education contents that will move the continent. Thank you very much, everyone. Have a nice day. Be safe. Until we come here next time, keep watching AAU TV. Have a nice day and bye.